Hi everyone, good morning, and thank you so much for joining me today. My name is Janine Dominguez, and I'm a clinical psychologist at the Child Mind Institute. We're a national nonprofit that supports children and families with gold standard mental health care, advice, and resources, all online and accessible to everyone. You can learn more about the resources we have available for families during the coronavirus crisis, including telehealth evaluations and treatment, by visiting childmind.org/coronavirus. Today, I'd like to talk about how to set and maintain healthy boundaries, both at home with extended family, potentially with coworkers, and answer your questions about that and anything else you're wondering about. Post your questions in the feed. We'll also post some links to helpful resources on childmind.org and details about the next Facebook Live. Remember, we're here every day at 10 a.m. and 4:30 p.m. and we look through your questions daily. So we've had several questions come in around setting and maintaining healthy boundaries during this time. This can mean setting boundaries around your own personal space and protected time at home, setting boundaries around what you want to talk about and the information that you're getting from friends and family. It can also be around setting boundaries around what you're able to do right now with work, working from home, schooling from home, and being a parent. So some of the things just to keep in mind when you're trying to set and think through how to maintain some of these boundaries is that the first is really tapping into what your values are. What is important to you? And those values can be health, it could be family and connection, it can be caring. And the reason it's important to tap into these values is that it helps guide the why behind what you're setting in terms of your boundaries and your limits. So for example, if health right now is really important and that's something that you very, very much value, your boundaries might be around keeping to social distancing. And so when potentially grandparents are really missing their grandkids and wanting to come over and saying, we've already spent so much time apart, why can't I just stop by? You can really be rooted in those values and what's important and saying, health is really important right now, so we really need to keep to social distancing, and let's think about other ways in which we can keep connected. This can also be an opportunity when you're setting and maintaining boundaries to model empathy and perspective taking with your children. In understanding other personal boundaries and what other people need, it does require knowing how a person feels, what they need, what their perspective is. And so it is a good opportunity to, again, model empathy and perspective taking. And that can simply be done by just how you even respond to your child if they're having a difficult time. So it might be, I'm sorry you're feeling sad, I'm here to help, and also if you need some space, that's okay too. So utilizing that language as a way of modeling, you really trying to understand how they're feeling, where they're coming from, and also giving them what they need potentially during that time. And this can help you to create your own need for space as well. This language can help you set your own boundaries around personal space and creating that time. For example, saying things like, I love spending time with you, and it's also important that I have my own time to recharge and also to help me to calm down, and this is what I need. And this can also be done as a family. You can have boundary setting and limit setting time in a discussion with the family, setting quiet time maybe for everybody to get their own personal space and needs met. And lastly, setting boundaries can also be around how you're communicating with others and what they're communicating to you. So during this time, if you're having family and friends that are sharing a lot about the news and their own worries, that might be a limit for you, and that might be something that you need to set as a boundary. And that can be done by saying, I appreciate being the person that you can come and talk to, and I love that I can talk to you as well, but I also feel like we need to create time when we're talking about worry and time when we're talking about other things that are happening in our life or things that might be fun to talk about. I can feel myself getting burnt out even when with my own worries, and I thought this could be helpful. So again, really setting that tone, setting that limit, being able to be honest about how you're communicating that and what's important for you at that time. I know personally, me and my partner just recently had this conversation as we noticed our own conversations starting to become about just worries and the news. So together we decided to kind of create some boundaries around what would be helpful for us. So in summary, again, when setting limits and setting your own boundaries and maintaining them, really sticking to your values, what's important to you, utilizing it as an opportunity to model empathy and perspective taking with your children, and just be truthful and not apologize for what it is that you need during this time or what you think is going to be beneficial, because it is really important to set those boundaries. So this would be a wonderful opportunity to ask some questions. Again, if you're just tuning in, my name is Janine Dominguez, and I'm a clinical psychologist at the Child Mind Institute. If you're looking for resources for parenting during this time, please visit childmind.org/coronavirus. So one question that we received that I thought would be helpful in discussing is from a single parent who really does need some alone time to process everything that's been happening. She said it doesn't seem like kids really understand this need for boundaries and this need for personal space, and they even follow her into the bathroom. What to do? So I can imagine, especially as a single parent during this time, it might be really difficult to sort of set those boundaries, set those limits, not having somebody who can come in and actually spend that time with kids while you're needing your own space. And it's also really important to communicate that to your kids. And so one of the things that you might want to do before maybe even setting that limit or boundary is checking in around safety and worries, asking them what they might be worried about, if there are any anxieties around spending time alone, making sure that they know that they're in a loved home, feeling reassured that we're protected and healthy. And then I think it's about having that conversation and being direct, meaning talking to them about how it's important not only for them and you to take your own space to recharge together. So you can even do that in collaboration in setting up doable time when you can do that. So it might be the morning time, afternoon time, in the evening, when it's best to have some of that personal space. And when you are setting that personal time for yourself, it might be helping them to think through some of the things they can do during that time on their own as well. So finding things that they really enjoy doing, finding things that they would have fun with on their own, so that way when you're spending your alone time, they're also spending that time and finding it as a way of recharging and finding it rewarding. And the other thing I would suggest too is after taking that personal space, maybe the coming together, it being of value as well. So we know that children find attention to be incredibly rewarding. And so what that means is that time for personal space and me time, we don't want that to be communicated as something that's punishing or something that's negative. And so in order to do that, it's also about the coming together after taking some me time and making that of being very valuable, saying thank you in terms of being able to give that space, and also then just coming together and having a valued time. The last thing I would say to that is prior to spending so much time at home with family, I'd be curious to maybe see if prior to the coronavirus they also had some separation anxiety or an anxiety about being away from you as a parent. And if so, and you feel like that's increased, this also might be a time to reach out to a mental health provider if you had one prior, or even reaching out and being able to get treatment and advice around how to be able to help your child deal with some of that separation anxiety even currently. I mean, certainly that can still be the case even if everybody is home. So at the Child Mind Institute, we're providing telehealth treatment, evaluations, consultation as a resource even currently in order to provide that treatment that's still needed. So that's another avenue to pursue and sort of think about in terms of seeing anxiety increase during this time. So again, if you're just tuning in, my name is Janine Dominguez. I'm a clinical psychologist at the Child Mind Institute, and we're answering questions right now about any parenting tips, any parenting questions during the coronavirus crisis. So one question is how to handle ADHD kids during this time and during this period. I think that's a really great question. What we know about ADHD is that certainly it can have an effect on focus, on attention. It also can have an effect on hyperactivity. And so certainly there's a couple of things that would be important during this time. I would say one, in terms of having, again, structure and routine, depending on what is being found to be difficult during this time. So when it comes to attention and focus, I think setting up expectations of time where focus is needed and routine around when that is, but also keeping in mind when it's needed to be active and coming up with ideas around how to maybe get some of that energy out. So whether it's again, setting up structured time where you're going outside, running around, playing outside, going for bike rides, really getting some of that energy out is going to be very much important. Again, I think routine is really important during this time, especially for kids with ADHD, and sort of understanding what those limits are and what those boundaries are. Really maybe putting into place some positive reinforcement, meaning really catching children doing what they need to do or what you're asking them to do and immediately praising them when they're doing that. And lastly, again, as I mentioned before, if your children were connected to a treatment provider, really being in touch with them as well and getting the help that's needed during this time in order to structure that time, in order to get some advice around behavior and management at home. Again, as I mentioned before, at the Child Mind Institute, we're providing telehealth treatment, evaluations, and consultation to those in need. And so it might be also a time, especially since there's been a lot of difference in sort of the new norm, to really touch base with your treatment provider and see uniquely what might be best for your child as well. Another question that's come in is around any tips for toddlers, so around the 2 and 3 year old age that might be on the spectrum. Potentially during this time there might be some symptoms of restlessness, not being able to calm down. So that's a really great question. I would say the first thing or the first piece of advice might be to think through what was helpful for your child prior to this new norm and the coronavirus crisis. So when it came to restlessness, when it came to helping your toddler to calm down, what was it that was being utilized prior? So for some kids on the spectrum, that might be sensory, coming from a sensory perspective, so things around the environment that might help them to soothe and calm down. It might have been more structured activities that might have been helpful as well. And so really utilizing what was helpful then to really set up that time now. I would also say that, again, that having a routine and structure to their day is probably also another way of helping them to not feel so restless. I think having that predictability and that certainty can also be helpful. It also allows them to know what time is for maybe more structured activity time, what time for family time, time for outside, and so that predictability and routine is going to be helpful. I think also just generally staying to a routine of morning routine, wake up time, bedtime, when you're eating your 3 meals, a healthy diet, healthy exercise is also really going to be important, not only for toddlers on the spectrum, but really toddlers in general. As we know, children at that age really thrive on predictability and structure during that time. We are also going to be posting a resource that we have on childmind.org around autism and some tips for talking to your children who might be on the spectrum about this time and the difference. And so that way it can help them to understand why there's been a difference and how. There's some really great social stories that you can utilize that really simplify the language, have really good visuals that could be helpful in helping them to understand what the difference looks like right now and the why behind it. And speaking of visuals too, that might also be very helpful to helping them to create sort of a new routine and a new structure at home too. So that way they're understanding what is expected, what's going to be happening next can also be helpful. So again, if you're just tuning in, my name is Janine Dominguez, and I'm a clinical psychologist at the Child Mind Institute. For more resources, please join us at childmind.org/coronavirus. We had another question come in about feeling really anxious and also how to maintain some boundaries around information that you're receiving in terms of articles or how people are talking to you about everybody dying. And so this is around how to maintain those boundaries with friends. And it's one, recognizing that some of that talk is not helpful for your own mental health, and how to ask in a way or set that limit and that boundary with a friend. And so I think going back to the beginning, as we discussed, just maintaining healthy boundaries in general, one, keeping to what is of value to you and what's important. So again, if it is important that you are healthy right now and you're maintaining your own mental health, then not feeling guilt around being able to stay true to that value and sticking to it. I think also utilizing this time to communicate openly and directly to your friend and to your loved ones who might be utilizing you as a way of feeling assured or just talking to you about a lot of these things, and it just might not be helpful for you. And so some of the language that you might want to use, again, is saying, I really appreciate that you are utilizing me as a person to talk to about these things, and I get it. It's a really difficult time, a lot of uncertainty, and also I just want to be able to set time aside when we talk about those things and also talk about other things because I'm needing support in other ways as well. And so then maybe it's collaboratively coming up with a time when you're maybe worrying a little bit together, but also then really being mindful, making sure that you're spending your time talking about other things and supporting each other in other ways. I also would say it's okay to take a break while we're talking a lot about during social distancing, also keeping connected. I think that's really important, but also it's okay to need that space for yourself from friends and family if you're needing to turn down the intensity of how you're feeling, needing to turn down the intensity of feeling anxious or nervous or frustrated, and that's okay to be able to take that space. And again, you can be modeling that for your friends and family and saying, I love to stay connected, and I love the support, and I'm also going to take a little bit of a hiatus during this time, and take some space for myself, and then when I'm ready to reconnect, I'll reach out. And you can do this also in very specific protected time kind of ways. I have wonderful work colleagues who also, when it comes to like 6 p.m., 6 to 8, that's their protected time, and and they keep to that limit, and that's great. And actually, it's kind of helpful for other people to know that, so that way they don't necessarily feel uncertain about, like, is this an okay time to reach out or not? If you're sticking to your limit and making it about that, that's great. We know what you need, and others know what you need too, and also it can help you to feel really great that you have this time to utilize for yourself. It also keeps you to that limit, if that makes sense as well. It keeps you to that boundary if you're needing it. So I think overall, really during this time, understanding what's important to you, what your values are, being okay and not feeling guilty around setting those limits and boundaries for yourself is incredibly important during this time. I really appreciate you guys joining me. I want to thank you all again. I hope it was really helpful. And remember, we're here every day at 10 a.m. and 4:30 p.m. We look through your questions daily. Please check the post for the topic of our next live. The Child Mind Institute is here to help with the mental health and parenting needs of this coronavirus crisis, no matter where you are. We have resources to help, from daily tips to consultations to gold standard telehealth treatments. Please go to childmind.org/coronavirus. Be safe, and thank you.